go through the lecture. Now, we have studied some common medical pathological terms that as a professional you have all have to know or have some information about the meaning of these words. Now, today we discuss how we classify diseases. Now we are trying to go through this lecture only in English because we haven't told many times that we should not speak anything, we should not say anything in Kurdish, and I think it's for your advantage. If you have any problem understanding something, you can ask me later. Again, I'm advising you, if you have any difficulty understanding anything, you should go and enter the meaning of words or phrases or sentences in Google or ChatGPT, so you understand. So daily you have to try to make your English better. Now, we have many ways to put diseases into different types, to classify them. So why it's important to classify disease? What is the point of doing this? Anyone? Why we should know what kind of disease is this one or the other one?
I think it's to know the type of the disease.
Yes.
And which stage is it, or the level, or something
and so
like that.
that we can find the right solution for it. ويبزين كشارسالي كده الكراوي هبه هرشتو نخوشي كي خاص.
Yes, good. Yes, this is both good. But please, later after the lecture, you go try to find out or ask ChatGPT why classification of diseases are important. But both the answers are good. Now, we have many ways of dividing of classification of diseases, many different ways. Like the first one is written here by etiology. Etiology is the science that study the causes. So we can divide the diseases according to their causes. Here, the classification by etiology is, we can say that diseases is either infectious or non-infectious disease. So everything, every diseases in the world can be classified here is either infectious or non-infectious. Now, the important thing, we know the difference between infection and inflammation. Infection, it means when there is a another organism, a living organism, goes into our body. So it's like, so we are talking about bacteria, viruses, fungi. So these, when they go, they enter a human body, they cause diseases. Anything else that's not infectious, we can say it's a non-infectious disease. Cancer, for example, is a non-infectious disease. Fracture, broken bone, is a non-infectious disease. Congenital diseases are non-infectious diseases. They are not caused by viruses or bacteria. coronavirus is an infectious disease. So this is just one way of classifying diseases. Now, if we say that obesity is a disease which is a non-infectious disease. What is the difference between bacteria and virus? Anyone? Okay. Now, so this is one way. One way of classification is by etiology. So another way of classifying diseases is by the system that the disease affect. The system, by the system we mean the system inside our body. So we have cardiovascular system. The cardiovascular system, all of you know, that's we mean by this our heart and the circulatory system, the blood vessels. So there are some diseases that affect the heart, like we have many common diseases, like myocardial infarction, coronary heart disease, high blood pressure, and we have a lot of congenital diseases. One of the commonest diseases, congenital diseases, in newborn babies are in the heart. There are problems with the valves. There are problems with the walls. A lot of problem with the major blood vessels. They are all congenital. So this is cardiovascular system. And then the second system is respiratory system. So we have a lot of respiratory diseases, especially nowadays, and especially in this season. We have many different type of diseases in this system. Examples written here like asthma, like chronic obstructive pulmonary disease. Who know what is COPD? Chronic obstructive pulmonary disease. تعلموا يا جماعة.
Mister, it's like a disease, a lung disease.
COPD.
Isn't it like a lung disease or something?
It is a lung disease, yes. It's written under respiratory disease. This is a very common disease. And the reason why I am asking you this, so you remember, this is,
Master ربوة
sorry,
ربو
tényleg nem Yara tényleg istem.
ماسا نخوشتك ربوة
أسماء الربوة أسماء كنسراوة أسماء نسرابو. Chronic obstructive pulmonary disease, the reason why I am asking you this, because the main cause for this disease is smoking or vape or nergala. And this is a disease that's not that cannot be cured. Once you have COPD, that's you are going to have it for the rest of your life. Usually it happens in the later stages of life. Usually we don't have young people that have COPD. Usually it's happened maybe start beginning after 45, 50. But it's very, very heart disease. These patients, they have problem, a lot of problem breathing. Most of them, especially at the later stages, they have to be on oxygen almost every day. And the reason for this is smoking. It's a progressive disease. It cannot be cured. So for those who are a smoker, think about this. Now, so another example is pneumonia. The last word is pneumonia. Pneumonia is a infection of the lungs. So in the respiratory system, if you look at the picture, usually we divide the respiratory system into the upper part, upper respiratory system, and the lower. The lower is the lungs. So when we have an infection in the lungs, have, this is called pneumonia. And sometimes pneumonia, especially in elderly, it's very hard to be treated. It's a very severe infection. Most of like flu, other things is happening in the upper part, which is usually they have easy symptoms, simple symptoms. A lot of patients, they don't have problem, but when they have pneumonia, a lot of them, they need to be admitted and given antibiotic. Rabu is asthma. Asthma rabwa. Now, another system we have is gastrointestinal system, and then we have diseases here. Can someone tell me a disease that relate to this system, to gastrointestinal system? Any diseases? Any name of any diseases? Anything? So we have a lot of diseases here. And especially in this system, we have a lot of different compartments. Like when we come and study this system, we study, for example, the stomach and the bowels differently. And then we study the liver and the biliary system differently. And then we study the pancreas, for example. They are all considered part of the system. A lot of time they have been discussed together. One common thing is GERD, gastroesophageal reflux disease. Maybe among you, there are one of you have GERD. This is by Kurdish, and they say dalakza. The main symptom of this disease is heartburn. It happens for many different reasons. Another example is inflammatory bowel disease. And another example, something called liver cirrhosis. Liver cirrhosis is very common, unfortunately, here. It's very common. And a lot of time, we see a lot of young patients with liver cirrhosis. تشمع الكبد بمنبوني جگر. Why it is very common? It happens, one of the causes why people have liver cirrhosis, one of the main causes is alcohol, heavy alcohol drinks. I have seen a lot of friends and colleagues and people around me that have died from liver cirrhosis. Why? Because of alcohol drink. So heavy alcohol drinks, all of you know, it's actually this problem. We have a lot of smokers here, and we have a lot of drinkers, and we have a lot of heavy drinkers. What do you think the treatment of liver cirrhosis is? Jakie szczeble? تصورك كان علاجك يجيبه. liver cirrhosis جماعة جوتان لما وايا.
Yes.
Okay, liver cirrhosis. If a patient reach a stage of liver cirrhosis, the only option is a liver transplant. You have to transplant a new liver for the patient. Otherwise, the patient will die very soon.
دكتور أجر مرحلة سرتا كان بأكري علاج هيباتيتس سي بو بكاربيني.
Yes, if the cause is hepatitis, because as I said, we have many different reasons for liver cirrhosis. One cause is alcohol. Other cause is hepatitis, viral hepatitis, or autoimmune hepatitis. So if the cause for liver cirrhosis is hepatitis, you have to treat the hepatitis. But if the liver reached a certain level of cirrhosis, it cannot go back to normal. Maybe you can stop it at one stage, but it cannot go back to normal, the liver. Usually, the earliest stages of cirrhosis is fatty liver. When you do an ultrasound of the liver, it show the doctors who do the ultrasound for you tell you that your liver is very fatty. At this stage, this is the stage that you should then look after yourself before it goes to liver cirrhosis. But yes, you can. If the cause of the cirrhosis is alcohol, the treatment of hepatitis is not working. So then we have another system, which is the neurological system. And we are talking about the brain, the spinal cord, and the peripheral nerves. So one common disease that's very common in elderly is Alzheimer's disease. Parkinson is another example, and then multiple sclerosis. These three examples they're very common here. We see a lot of young patients with multiple sclerosis, and then the first two they're happening in elderly usually. I am sure you all either have a relative or know someone who have a relative with Alzheimer's disease. Why do you think Alzheimer's disease is very common nowadays compared to many years, like let's say 30, 35 years ago? Why do you think is this? Bochi Alzheimer's disease is a very common Wokujarania.
Maybe lack of communication. Social interaction can lead to that as well. People stay in their rooms as well nowadays more than going out.
What was the second part, sorry?
And instead of going out and just like
Yes.
interacting with people, they stay at home and be alone.
Good. This is very interesting and a very clever point. Yes. Uh, Maybe this is one of the causes. Like if you look at the new generation nowadays, one problem with them is they cannot communicate because they spend most of the time on the computer or on the phone or playing PlayStation. Other other problems with this generation, they have problem with their eyes. If you compare the power of the eye of the young of the children nowadays to the like those like 20 years ago, you'll find out that they're gradually losing their eye power. They cannot see far away. Why? Because they are focusing most of the time in front of them. So yes, one causes of Alzheimer's disease may be the lack of communication. This is good. Another reason is that nowadays people generally live longer. If you go and look in Google, like from 50, 60 years ago, the average lifespan was much lower than now. So when you get older and older, you get more chance of having Alzheimer's disease. Plus many different other reasons. And it's a very, very bad disease. If someone of you have someone with Alzheimer's disease, you will be sorry for them because they are in a very, very bad situation, those patients, not only themselves, but the family as well. And then we have Parkinson. Those with Parkinson's disease are the people who have tremors, usually, either in the hand or in the limbs or in the legs. Parkinson's disease. And then another system is musculoskeletal system. So we have diseases here. This is all classification of diseases. So when we say musculoskeletal system, we are talking about the muscles, the bones, the joints. One very common condition was osteoarthritis. Another example is rheumatoid arthritis. A very common disease is osteoporosis. Osteoporosis is a very common disease, especially in females after the age of 45 to 50. Osteoporosis is a very common disease. What is osteoporosis? Who knows?
هشاشة عظام.
Yes, correct. Well done. Yes. And it happens because of what? What is the reason why osteoporosis happens?
Lack of calcium.
Yes,
اللي قلتها منى.
yes, lack of calcium. This is very common. Is one of the I think we discussed in the previous lectures with you as well that this is because it's a very common disease. That's why we have a specific equipment in the X-ray departments, a specific tool for this disease, which is, if you remember, What was the name of this equipment?
DEXA scan.
Yes, the X-ray scan. That's why it's because it's very common. It's like, for example, colon cancer is very common in male. So that's why in European country after age of 45 to 50, they do colonoscopy for them to screen them, to pick them early. Like prostate cancer in men is very common. That's why at certain age they have to do certain investigation. Like breast cancer in female, that's why all over Europe and USA they do regular follow-up, regular investigation for young and middle-aged females. Why? Because the breast cancers are very common and they are treatable. They are very easily treated if they get picked up early. So we do screening. This we are calling this screening. We do screening for a specific type of disease. It has to be common and it has to be treated. We are not, if a disease is cannot be treated and common, we are not going to do screening because there is no point. Now another system is endocrine, and we have here we are talking about the glands, different glands in our body, like thyroid gland. We have glands everywhere. We have glands in the brain, as it's shown in the picture. So any diseases that affect these glands is the endocrine diseases. Like one very common example here, I think I mentioned with you before many times, is the thyroid problem, which is very common here. Thyroid disease, like thyroid cancer, hypothyroidism, hyperthyroidism. This is an unbelievably common disease here in our area. Like diabetes. So diabetes can be classified here. It's a hormonal disease, it's a endocrine disease. A lot of diseases, they can be put inside different category, inside different systems. Now, another system is dermatological system, dermatological disease. These are diseases that's happening on the skin, hair, nails. And these diseases are major causes for people to go to doctors. Why? If you go into a clinic of a dermatologist, most of them, they have a lot of patients. Why? Someone has why the dermatology clinic is always full of patients? Because we are dealing with beauty, yes? When you have a problem on your skin, especially if it's on your face, especially in females, they go straight away to seek treatments. And another reason is that because the patients see it. Like when you have something on your skin, biologically you get worried about and you go to the doctor. But we have a lot of patients with hypertension, with high blood pressure, for example, and still like this even nowadays. They die because of hypertension. They don't seek treatment. Why? Because they don't see it. They have high blood pressure. Most of the time, they don't feel anything, so they don't take treatments. So they die with CVA, with stroke. But when you have a skin condition, because you see it, you go and see, and most of these skin conditions, they're actually simple diseases. Some of them, they don't even need treatment. And then another reason, as I said, is the beauty. It has something to do with beauty. Now, another system is hematological system, the blood system, let's say. Diseases that happen inside our blood. One very common disease again here, if you go to Khastkhani Hiwa, you will see a lot of patients with leukemia. And we have many different types of leukemia. Some of them are very lethal. Some of them, fortunately, can be treated, can be cured. But again, we see a lot of patients dies from leukemia. Another one is hemophilia. Hemophilic patients are those with have problem with clotting of the bloods, so they can bleed very easily. Again, this is very common. We have many different types of this. Some of them, they need treatment for the rest of their life when they have after the diagnosis. So we finished classification of diseases by first etiology, which was infectious and uninfectious. Then the second way of classification was by the system. And then this way of classification is by pathophysiological mechanism. By pathophysiological mechanism. So the first one is inflammatory disease. So if you remember, we just mentioned in this lecture what is the difference between infection and inflammation. So some diseases are inflammatory. So like rheumatoid arthritis, like inflammatory bowel disease. Inflammatory bowel disease is very common in young people, but it's fortunately it's very rare here, but it's very common in Europe. Inflammatory bowel disease and asthma, these are inflammatory diseases. Why we have inflammatory diseases? For many different reasons. It can be because of an infection. When you have a bacterial infection, the bacteria cause inflammation. Or it can be because of a toxic substance. Or or it might be allergic reaction. So I asked you a question, what is the difference between virus and bacteria? So it's written here. The reason why I ask you this question to see if any one of you have read the slides, because the answer is here. So you haven't read this slide. So this is the difference between viruses and bacteria. So the viruses generally are smaller in size. So usually we have DNA or RNA virus. We cannot say they have an organized cell structure, but the bacteria are larger. They are unicellular, one cell. The bacteria usually are one cell. Bacteria are very adaptable. What is the meaning of this? Someone? What do we mean when we say that bacteria are adaptable?
ماساواتە توانێت خۆی بگونجێنێ لە زۆر
Yes,
شوێنە
yes.
تەکەیف بکە لەگەڵ شتەکانە.
Well done, yes. And this is very important. Think about this. Why generally bacterial diseases are much more commoner and widespread more than the virus? Because viruses, it's written here, they cannot live outside a living cell. What do we mean by this? If I have a coronavirus, for example, and if I sneeze, some viruses go out with the sneeze. So these viruses that go out, they have a very short window of time to survive outside the living cell. They die. But some bacteria can live somewhere outside the body of a human being or another organism for so many years. But viruses cannot. And both viruses and bacteria, they can mutate. For example, you all remember the time of Corona. When the Corona started, every now and then, there were new mutation of the virus coming. This has happened of the adaptability of some viruses. They change themselves. Like the bacteria, we have many antibiotics that we were given to a certain bacterial infection that's not working now. جاران مثلا بو نخوشی ملاریا بابلين يا خو بعض علاجێکمان بەکارێنە ئێستا ئیژ ناکە بۆ لەبەری بەکتریاکە خۆی ڕائهێنێ لەگەڵیا. The bacteria adapting itself, so we have to change the antibiotic with times. So that's why, this is the reason why we have something called hospital-acquired infection. Hospital-acquired infection. What do we mean by hospital-acquired infection? Usually in hospitals, the types of bacteria that lives in the hospital, just think about it like this. They are different from the bacteria that lives outside the hospital. They are stronger. So the treatment sometimes, a lot of time, of hospital acquired infection is much more difficult than the same infection if you get it from a bacteria outside. Why the bacteria in the hospital are stronger? You look at this subject later if you are interested. Now we have something, another one is, another way of classification is goes under the name of degenerative diseases. So if I ask you in the exam a question, define degenerative diseases, you have to say these are group of diseases that results from progressive deterioration or loss of function of tissue or organ. If you write this, that's it, you get full mark. If you don't write the same words here, it's okay. You can write something with your own words. As far as the meaning, you mean what's written here is, that's it. You feel you get full mark. An example is Alzheimer's disease. So Alzheimer's disease is a type of degeneration. Osteoarthritis is a type of degeneration. So in Alzheimer's disease, there are the degeneration of the nerves. Part of it is losing with years in elderlies. That's why you get Alzheimer's disease. Osteoarthritis is a degenerative disease. Why? Because part of the bones, especially in the joints, get wear down. وردو تلا إيشك قراقي إسقانا كان بون منا بويا osteoarthritis. Macular degeneration. This is something happening in the eyes. Or sometimes, is very important, sometimes the cause for degeneration, as written here, it happens in young people, sometimes in children. For example, after traumatic injury. What معناه وشتا degeneration happen in young population after traumatic injury? Try to think about it and give me an example, anyone. A good example, when a child or a young boy or girl have a fracture of this bone, for example, and they put it in the cast for them, they don't use this muscle for, like, let's say 6 weeks. If you look at this muscle and compare it to this one after 6 weeks, you will see they are slightly smaller. Why? Because it has not been used, because of the fracture, because of the broken bone. This is a degeneration. So it can happen in young population. So we have some diseases that are neoplastic, that are cancer or tumors. So here, it's important for you to distinguish between benign tumors and malignant tumors, cancers or non-cancerous. What is the main difference between benign and malignant? فرقة مهمة كي بين benign tumor و malignant tumor جيا سرطان حميدة وسرطان خبيثة. What is the main difference?
مەلیکناند ئەدڤانس کانسەر بوواتە ئەکرا نەخۆشەکە بکوژێت بەڵام بیناین حەمید بوو نەخۆشەکەی نەئەکوشت بەڵام نەئەبوو بەجستەیە.
Yes. What else? Good. 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 One very important and thing that differentiates between benign and a malignant tumor, that malignant tumors, they have the capacity to go to metastasize. Can you mean metastasis? So it goes from this and from this place to another to spread. While benign tumor, they don't have this capacity. They stay there. This is a very important feature because, as Gershbein said, if it is malignant, it can kill you if you don't have treatment. A lot of benign tumors, they don't need treatment. Unless in specific scenarios that we treat benign tumors. So an example of a cancer or malignant tumor is melanoma. So just remember, when we say cancer, we are talking about malignant tumor. Non-cancer or non-cancerous is benign. Melanoma. Where is this cancer? The melanoma. Where is it in our body if it happens?
I think in the skin.
Yes, good, in the skin. It's happening in the skin. It's very common in some countries, like in Australia. It's very common. It's much commoner in white skin people and fair skin people. خلقي سبيبيستا زياترا ميلانوما. أنا كسبيبيستن أوروبي وأنا. And these are some examples of malignant tumors, like malignant meningioma. It happens inside the brain, or fibrosarcoma, or liposarcoma, or leukemia, lymphoma. These are all cancer, all malignant. And lipoma is a benign tumor. Hemangioma is a benign tumor. Papilloma is a benign tumor. So you have to know these names. So if I ask you to give me examples of benign tumor, you have to write lipoma, hemangioma, papilloma, meningioma. Why do you think people get cancer? What are the causes of cancer?
Smoking.
Yes, smoking. What else?
Mister, it's probably because mostly because of their immune system. Their immune system is not fighting off the cancerous cells.
Yes, well done. Yeah, one other causes is the immune system.
It's by heredity, maybe.
Is what, sorry?
Heredity.
Yes, this is very important. Hereditary. So a lot of cancers are hereditary. You get it from your parents. It comes to some people on the chromosomes when they have a mutation. So that's why we have, when we are talking to a patient with cancer, one history, that one information that we want to get from the patient, if there is any family history of the cancer. This is very important, specifically in some cancers. Sorry, 1 second. Sorry, Jamaat, I am sorry. So, as we said, is some type of cancers is very important, family history. For example, colon cancer. Why it's important? Because it runs in family. For example, if we see a patient with colon cancer, like we see a sometime very young patient, like 25-year-old boy with colon cancer, then we ask all the family to have a colonoscopy, because is a cancer that runs in family. So yes, one causes why we get cancer is because we have a mutation or abnormality in the congenital abnormality or hereditary abnormality of our in our system, in our chromosome, in our gene. Okay. Some other diseases are autoimmune. So they have something to do with the abnormality of our immune system. So these are examples. So if I say list 5 examples of autoimmune diseases, you write this 5: lupus, scleroderma, diabetes, multiple sclerosis, rheumatoid arthritis. So these are autoimmune. It has something to do with abnormality or abnormal responses of our immune system. ئەوەی کە بە کوردیەڵێ مەناعی جسمی خۆی نەخۆشەڵێ مەناعی جسمی خۆم هجوومەکات سەر لەشی خۆم. Autoimmune. So there is a problem with your immune system. So then we have metabolic diseases. Metabolic diseases like diabetes mellitus. So if you notice that we put diabetes mellitus in many different categories. So it is a metabolic disease. At the same time, it is an endocrine disease. And sometimes it can be an autoimmune disease. So another example of metabolic disease is hyperparathyroidism. Like dehydration we can consider it a metabolic disease. This is very important, dehydration in elderly and a lot of time in very small children. Dehydration kills elderly patients a lot, especially after the age of 75 or around 80. They get dehydrated very easily and they die very easily from this. When for every few years we have a lot of patients with diarrhea in Slemani. لە پڕێکە 2-3 ساڵ جاریا خەڵک تووشی سکچوو نەبێ. Especially in elderly, they cannot tolerate this diarrhea. Most of them, we admit them. Why? Because they get very tired. Why they get very tired after the diarrhea? Because of dehydration. Some of them, from the diarrhea and dehydration, they reach the level of renal failure. Their kidney shut down. So we do dialysis for them, and some of them dies because of this. So dehydration is a very important disease, especially in elderly. لەوانەیە بیست بێتان ئەڵێ کابرا داغڵیان کردووە تووشی سکچون بۆ 3-4 ڕۆژ ئێستا غەسلی گورچیلی بۆەکەن. زۆر جارەگەر نەکەی ڕەبتی نەکەیتەوە بۆچی سکچون غەسلی گورچیلی بۆەکەن. Because with diarrhea, they get dehydration, and with dehydration, some of them, they go into renal failure. That's why they need dialysis. And then we have traumatic disease that happens because of trauma, like in the picture. For example, a gunshot, a box, or a road traffic accident, or you fall from a height. So you get fracture or broken bone, you get different cuts, you get lacerations, strains, bruises, burns. So these are examples of traumatic diseases. Now we have congenital and hereditary disease. So please, you have to know the difference between congenital and hereditary. So when we say congenital, we mean something, and when we say hereditary, it's completely different thing. You have to read this and know what is the difference between congenital and hereditary. Someone tell me, what is the difference between congenital disease and hereditary disease? لێرن جەماعەت بە تۆزە بەناوەکانتانە بڕەمزان کێ لێرە نییە؟ لیندا لێرەیت؟ لیندا ئازاد؟ ئادێ پەنجەیەکم بۆ بنەرە لیندا، بزانم لێرەیت؟ ئەوە لیندا لێرە نییە. لیڤا لێرەیە؟ ئەوە لیڤا لێرەیە. نەوا؟ ڕێناز لێرەیە. سەهند لێرەیە؟
جان دکتۆر یان لێرەم.
زان لێرە باشە. تۆقە لێرەیە وایە؟
Yes.
Yes, good. چێ لێرە نەبوو؟ لیندا لێرە نەبوو. دوای پێی بە
دکتۆر ناوی منیش نەخوێندەوە.
No, نەمخوێنێتەوە بە ناوەکانە بەسەری ئێڕۆم. Okay, so someone tell me what is the difference between congenital and hereditary?
دکتۆر کۆنجنتال لە کاتی لە دایکبوونەوە نەخۆشیەکەت لەگەڵایە، بەڵام هێرەدەری لاقی بە جنێتیکەوە هەیە وراثیە.
Yes, but if you look at them, both congenital and hereditary, you have it after birth, yes?
Doctor, both of them
Yes,
include genetic يعني ببني genetic or an. But when we talk about hereditary, the genetics have mutation over them. So they're not the same one as they had from the parents or their grandparents and stuff. They have changed and then came to the other persons, I think.
Yes, you are all right, but there was problem with your how you express it, but you're all right. So when we say hereditary, it means it has to be some problem with the chromosome and the genes. It has to come from your parents. So this is hereditary. But congenital, when we say it's congenital, it's not necessarily has something to do with the chromosomes. You still have it since birth, but it might be something with, for example, when the fetus develop in the uterus of the mother, there's a problem with this development. The baby doesn't grow properly, so it have some problem after birth. So there is no, like, let's say there is a fetus who doesn't have any chromosomal problem, any problem with their gene, and they start growing inside the uterus of the mother, and then at one stage there is a problem with this growing, then there is a congenital disease. So Down syndrome is a congenital disease. It's a very common disease here. You see a lot of Down syndrome every now and then in the market, in the hospital somewhere. اما جاران ناوێکی کەیان هەبوو چیان پێوتن داون سندرۆم؟ ئەوانەی داون سندرۆمیان هەیە؟ کێن ئەوانم داون سندرۆمن؟ کێ داون سندرۆمی بینیوە؟ نەخۆشی داون سندرۆم. Who saw these patients? Okay. So they have an extra chromosome 21. So the Down syndrome people, they have 47 chromosome. We normally have 46. The Down syndrome, they have 47. So again, an example of hereditary disease is cystic fibrosis, hemophilia. So if in the exam, if there is a question like this, Down syndrome is a hereditary disease, the answer is false. Down syndrome is not a hereditary disease. It's a congenital disease. I think a few years ago that was one of the questions, and most of the students answered incorrectly. Okay. So then we have a process of disease. What's happened? How it start? We are talking here about infectious disease. So I am here in this room now, and there is the air around me. Do you think the air we breathe contain viruses and bacteria? Like in this room or in your room?
Maybe yes. It depends.
Yeah, it depends on what?
On the place.
On the
Like
place.
there is a clean place and there is not.
Yes. There's most probably you will not breathe a single breath in your life without bacteria or viruses or something. There is always something around us. There's always the air around us is full of things. But we don't get sick with every breath because of many different reasons. Most of these bacteria are non-pathogenic. Most of these viruses are non-pathogenic. Some of them, if they are, we have an immune system who respond to to answer to most of these foreign organisms. And when we breathe, we don't breathe enough numbers of viruses, for example, to cause diseases. This is very important. Kati Coronaka, during the time of Corona, if you go inside the hospitals where there was a lot of patients with coronavirus, the air in the area, the environment was filled of millions and millions and millions, billions of viruses. So you get, with every breath, you get large amount of virus goes inside. But from in the outside, the numbers of the viruses was much smaller. So the more numbers goes in, the more chances of you to get the disease. So the first stage of infectious disease is the exposure. When you come into contact with the virus or the bacteria. So you come face to face. Then there's entry or transmission. Either for example, you inhale the virus, or I have corona, I shake hand with someone, the virus goes to him. I transmit it to him. So this is transmission. And then we have incubation period. One of the very important thing we always talk about in different kinds of infection is incubation period. So it's important for you to know what we mean by incubation period. This is very important. I give you a very common example, is a HIV viruses. HIV. The HIV توشی چه نخوشیت معنی HIV virus.
AIDS.
توشی AIDS. Now, well done. From the moment the virus goes inside your body, the HIV virus, most of the time, it stay in your body without causing any problem for a very long time. Then after some time, the disease starts. The time between the entry of the virus to your body to the time that you have symptoms, you have the disease, this is incubation period. Incubation period. That's why, for example, again in HIV and AIDS, when someone have the virus, they say HIV positive. They don't say AIDS, because they are completely different thing. HIV positive, it means he has the virus, but it doesn't mean that he has AIDS yet. The HIV positive patient, they still need treatment, but they're in an earlier stage and they have a better prognosis than someone with AIDS. So the incubation period, you have to know this. So after stage 3, then we have onset of symptom, when the symptom shows. What are some symptoms of AIDS, HIV? Only HIV يعني symptom كان تشيل اللي عندنا كذا. أو نخوشيك خلق ميلة ترسى. This disease that a lot of people fear and is very lethal, although not now. Yes.
So, HIV, like whenever it starts, it targets the immune system.
Yes.
So as time goes by, it really affects the immune system.
Yes, you are right. What are the symptoms? Nishanakani chia.
It can change by the stage we're in, but
Yes.
with many of the stages, for example, we experience flu-like signs like fever or
Good.
rash,
Good.
sore
Yes. Yes.
throat.
Yes. Well done. ئەمە هەمووتان ئەم HIV و ئایدزتان بیستەوەم زۆربەی کەس نیشانەکانی نازانێت چی نەخۆشەکە چی لێیە. If you are interested, you can go and read it. What are the symptoms of AIDS patient, of HIV positive patients? So after onset of symptom, then we have progression. So then
And here the disease will start to develop more in the body.
Yes, correct. Well done. So this is the stage of progression. كتابها ڕۆزە ڕۆزە ئێستایی دیان هاتیتەوە یان ڕۆژوت و هاتیتەوە یوسر
بەڵێ دکتۆر
ڕۆزە ئێستا هاو یان هاتوو یان هاتوو
ئەی دکتۆر نازام ئاگەم لێی نەبوو بەس وڵای نازام دکتۆر
دکتۆر یازم هات و ڕۆیشتەوە
هاتو ڕۆژتەوە
بەڵێ بەڵێ ئێستا هاتەوە
تەکیدی یان دیفاعی لێەکەیت
من ئاگادار بووم لێرە بوو مۆجود بوو.
Okay, then we have complications. So what is the meaning of complication in our language? The meaning of complication, the meaning of the word in Kurdish. Please have a look at it later. Then after that, we have the stage of resolution or chronicity. So mainly here we talk about infectious disease. So either you get cured either by itself, spontaneously, you get better, or you have treatment and you get better. This is a resolution, or it become a chronic infection or chronic inflammation, or you have a chronic disease. So the disease stays with you for a long period of time. Okay, so then we have recovery or sequel. For example, if you have a heart surgery, you have an open heart surgery, you will need a long time to stay in bed and rest so you recover. At the end, if you recover, if the patient doesn't die from this operation, there will be some sequel. Still, you can see the result of this operation on the patient for many years, sometime. For example, the simplest example, you see the site of the operation, or someone who have a laparotomy, abdominal surgery. If you look at the abdomen or at the chest, if they have surgery in the chest, after 10 years or after 20 years, 30 years, you still there's a scar. This is just an example. You see scars. The scars remains forever.
This also maybe happened due to the medical errors. Medical errors.
No. Yes, sometime, but ئەگەر بیری لێ بکەیتەوە بۆ نمونە عملیات کە تۆ عملیاتەکەی سکاری عملیات لا ناچێت قەت علاقەی نیە بە ئێرەرەوە. With white skin people, the people who have a very fair skin, the scar get much better. You don't see scar that much. Scar لە خەڵکی پێست سپیە سکاری operation کەمتر دیارە. The more darker you become, تا پێستە ئەسمارتر و ڕۆشتر بێ و سکار زیاتر دیارە. ئەی سکار هەر دیارە مێنێ زۆربەی کات علاقەی بە ئێرەری شۆ نییە بازە جارێ. But yes, sometimes is an error. If, for example, as some bad plastic surgeon, you go to have a plastic surgery on your face, and they do something bad on your face, the scar, the ugly scar, stay for the rest of your life. بعض جار غلطی سرجریەکەیە medical error. بۆ نمونە ئێستا rhinoplasty is very common here, especially in females, even males, young males do rhinoplasty, nose job. Is very common, and most of the patients who had rhinoplasty or nose surgery, they are not happy with the results. زۆربەی ئەو نەخۆشیانی عملیاتی لوت بچووکردنەوە ئاکان نەتیجەکەیان بەدڵ نییە. So now, do you have any question?
No, thank you.
Now, later, I hope, as I said, we go back to the campus next week. We don't know what's going to happen. Now, don't leave the room yet, please. Thank you for listening. And I will stop the recording now, but then